Hello, Tanya. How are you doing today?
Thank you.
Good. Good. I'm Debbie. I'm going to be your hygienist for today.
Great.
The first procedure that I would like to do is a head and neck exam.
Okay.
All right. What I'm going to be doing is palpating the lymph nodes and salivary glands of the head and neck area. All right. And I'm just going to be checking for any abnormalities. If you feel any pain or tenderness during this exam, you be sure and let me know.
Okay.
Okay? Okay, the first thing I'd like for you to do is lean your head forward a little bit for me.
Okay.
And I'm going to palpate the occipital nodes, which are located right back here in the neck area. I'm going to do a palpation right at the hairline, another one right below the hairline, and then another one right above the hairline. All right, Tanya, I'm going to take a peek behind your ears. Just checking for any lesions, anything abnormal behind your ears. All right, now I'm going to palpate the post-auricular nodes located behind the ear. And then I'm just going to slide around and palpate the pre-auricular nodes. All right, the submental node, the symphysis of the chin. All right, then the submandibular nodes. All right, Tanya, if you turn to the right for me, tilt your chin down just a tad. Perfect. All right, now I am palpating the cervical chain from where it attaches at the clavicle up to behind the ear. Then I'm coming down and doing the posterior of the muscle. All right, turn again the other way for me. Tilt your chin down, thank you. Once again, right here at the clavicle, all the way up to behind her ear, and then down the posterior. All right, and next, Tanya, going to do the supraclavicular right here at your collarbone, okay? You tilt your head forward just a little bit. I'm going to get behind that bone. All right. Now the parotid salivary gland, located on both sides. All right. And then the submandibular. I'm going to find the notch right in front of the jaw there, the angle of the mandible. Put your tongue to the roof of your mouth, and then I'm just simply going to push up. Tanya, so now I'm going to just check your TMJ here.
Okay.
All right, you just open for me a little bit. Open and find it. There we go, right in front of the tragus of the ear. Open and close. All right, close. Side to side. In and out. All right, open and close. Side to side, in and out. Great. All right, Tanya, so now what I'm going to do is place your bib, okay, and I'm going to give you a hydrogen peroxide, diluted actually, hydrogen peroxide rinse. And I'm going to have you rinse with this for 1 minute. I will time you, okay? And this is to just rid the mouth of virus and bacteria to make a cleaner environment for working.
All right.
Okay? you doing over there?
Great.
All right, it's been a minute. You can spit that out. Okay. Okay. So now what we are getting ready to do is a soft tissue exam. It is much like the head and neck exam in that I'll be looking and palpating different structures of the inside of your mouth, okay? Just looking for any abnormalities. Have you noticed anything popped up in your mouth that you're concerned about?
No.
Okay, great. Okay, Tanya, so the first thing I'm going to do, I'm going to take a look at the outside of your lips, underneath the gum light. Okay. Alrighty. Open just a little bit for me. Okay, and close. Okay. Okay, open. Open for me. Turn towards me just a little bit. All right. All right, Tanya, if you just bite down for me. Open. Open for me. Chin up a little bit. You'll say ah for me.
Ah.
Right. Now I'm going to touch the roof of your mouth, okay? All right, Tanya, this is going to be a little strange, all right? So I'm going to take a good look at your tongue, okay?
Okay.
All right. You'll stick it out for me. Open your mouth and stick it out. Very good. I'm going to look at the sides. Okay, you can lift it to the roof of your mouth and keep your mouth open. Great. Okay. Open for me. Just relax your tongue. All right, Tanya, now I'm going to check for some tartar above the gum line, okay? And to do that, I've got to use some air.
All right.
Are your teeth sensitive?
Not particularly, no.
Okay. All right, so I'm going to check for this tartar where your salivary glands are. All right, so on the top teeth, on the maxillary arch, that would be right here. All right, and I'm going to come over here, and if you would turn towards me a little bit. All right, and close down just a tad. going to check down here on these lower teeth. There you go. Would you like a little bit of water?
Mm-hmm.
You want to swallow that?
Yes, please.
Okay. All right, Miss Tanya, now what I'm going to do is I'm going to check for tartar below the gum line. Okay? So I'm going to have to use my Explorer to do that.
Okay.
And I'm going to check kind of in the same areas that we just checked. So if you would open for me. All right, so the first thing I'm going to do is get my finger rest. And then I've got to check to make sure that I have the right end of the Explorer. And I do because the lower shank is parallel to the long axis of the tooth. So I'm going to start at the distal line angle, walk it back into the distal, take it out, turn it, and then I'm going to walk it around the buccal and into the mesial. Open a little bit for me and just close down like you would normally. Bite down, just relax. And I'm looking at number 3 and number 30, the relationship of the mesial buccal cusp of number 3 to the groove, buccal groove of number 30. And I see that the mesial buccal cusp is in the groove, so she is a class 1. Then I'm looking right here at her overbite. You open again for me, Tanya. Now bite down again. And I would say that she has a slight overbite. It's a little bit further down off the incisal third of the tooth. And then, to check her overjet, I need my probe. Bite again. So this is the horizontal relationship here. And I measure this in millimeters with my probe, and I see it's about 4 millimeters.